Good afternoon, everyone. We're still waiting on a few people to join the call. We'll get started in just about 1 minute. We still have a few people joining the call. We'll get started in just about 30 seconds. Okay, again, thank you so much for joining the call today. Dr. Bonsall, your mic is open.
Thank you. Good afternoon. My name is Dr. Vidya Bonsall. I'm a board-certified pediatrician, mom of an elementary school son, and a proud native Nashvilleian. We physicians, mainly pediatricians and a couple of frontline ICU pediatricians, as well as Williamson County parents, are here today to urge the Williamson County Public School Board members and private school administrators, as well as our elected leaders, to act in the interest of public health for all children and follow CDC and AAP recommendations for universal masking in schools, making public safety the only thing you consider. The only discussion here today should be the health and public safety of our communities, and especially that of our children. As of August 4th, the Tennessee Department of Health reported 6 Tennessee children who died from COVID, 2 of them from Shelby County last week. To those 6 families, if you tell them COVID death is rare in children, it doesn't matter a bit. To those families who lost their children due to COVID, it's not a 0.02 to 0.06% statistic. For them, it's a 100% statistic. And Tennessee physicians are sounding the alarm bells. This is getting worse by the day. Just 1 month ago, Tennessee reported that pediatric cases doubled in just 1 week from 183 to 375. Just a month ago, Tennessee had a COVID positivity rate of around 1.5%, but today it's over 16%. According to the AAP report for July 29th, Tennessee currently ranks 6th in the US for the total number of COVID child cases, reporting over 150,000. Williamson County ranks 3rd in the state for the highest number of childhood COVID cases. This variant is more contagious than even chickenpox. For every 1 child with COVID, they will likely infect 6 other kids, which is much higher than the Delta variant, with this Delta variant than last year's variant. Its rapid rise, along with the refusal to embrace safety precautions such as vaccination, masking, and social distancing, is going to wreak havoc in our schools with widespread infections and further mutating. The above facts are reported by the Tennessee Department of Health and the AAP, and they don't lie, they are facts. Half of the kids with pediatric MISC, multi-system inflammatory syndrome, are between the ages of 5 and 13 years old with a median age of 9. This point of 5 to 13 is exactly the point where most kids are in school and not yet eligible for the COVID vaccine. We have an obligation to all children, including healthy children, kids with leukemia, kids with organ transplants, kids with asthma, immune deficiency, childhood diabetes, and other chronic illnesses. These kids are more likely to suffer more serious illness from COVID, and these kids too are your responsibility. These kids may not be voting for you, but their lives are in your hands. They have the same rights to both safety and education as any other child. We have an obligation to all children and parents in the district, and we ask you to listen to these doctors, both within your local community and the national experts from the CDC and AAP, who are recommending universal masking in schools. You are one of the kids' advocates, especially during this massive wave of COVID infection, which according to Tennessee's Department of Health Commissioner is predicted to fill up all of the children's hospitals by the end of this week. Kids don't die from wearing masks. Kids are dying from COVID in Tennessee as recently as last week. Your choice this week is to pick one: masks in schools or widespread COVID infections in schools. A COVID outbreak in schools that could possibly lead to school closures, parents missing work, businesses closing, kids sick with long-term cardiac and pulmonary complications of COVID, and even school kids and their grandparents' deaths. This is the alarm that Nashville hospitals and physicians are sounding out every day. Failure to listen to the physicians and nurses taking care of these COVID patients, and failure to recognize that COVID remains a threat in our schools when children are both unmasked and not yet eligible for the vaccine, is a willful act of harm to the children's right to life. Choosing masks in schools over COVID in schools seems like a common sense approach to protecting human life. If school board members, district health officials, and elected representatives are all on the same page when it comes to the health and safety of our kids, we can help end this pandemic from taking over pediatric hospitalizations and keeping all Tennessee kids safe. It is my pleasure now to introduce Dr. Maya Neely, pediatrician and a pediatric hospitalist practicing in Nashville. Dr. Neely lives in Williamson County and is the parent of 5 children, 4 of whom are attending Williamson County schools. Dr. Neely.
Thank you, Dr. Bonsall, for that introduction. I have lived in Williamson County since 2010 and have 4 children enrolled in the Williamson County School District, both in middle school and elementary school. And I wish, like so many others amongst us, that we were at a point in time where COVID could only be seen in our rearview mirror. Unfortunately, this new Delta variant of COVID has already shown that there is much that still lies ahead of us and much that we have yet to understand. As you heard Drs. Bonsall share already, this new variant of COVID is considerably more contagious and easier to spread across people, particularly when they are in enclosed spaces where there is limited distancing, like schools. I think another important point to bring up is that much of the spread is silent. That is, people are infecting others without yet having developed symptoms themselves. So you don't even know you're sick sometimes, and you've started giving the virus to other people before you've had the opportunity of knowing you need to quarantine. And speaking with colleagues both in Tennessee and in hearing the stories of pediatricians in hard-hit areas such as Florida, this virus is now affecting children more. We are seeing more infections and more hospitalizations. In addition, in children particularly, getting the virus itself may cause illness, and then 3 to 4 weeks post-infection, we can see MIS-C, an inflammatory condition that can affect multiple organs in a child's body, including the heart. And then there is long-term COVID, which is affecting children, some with only very minimal symptoms at the onset of their illness. Weeks out are seeing symptoms like fatigue, headaches, brain fog, and concentration issues. So all of that is to say there's a lot we are trying to protect our children from. And finally, as Dr. Bonsall alluded to earlier, there is a huge discussion last year about whether hospitals could handle the infection rate for adult patients. In pediatrics, where we have already seen an incredibly difficult respiratory season this summer with surging RSV infections, I think there is a real concern about the system being overwhelmed if this Delta variant progresses in the swift way it has across other areas of our country. So we want and are trying to protect our children from this virus, but we also want to make sure that each of them gets the education and social opportunities that only school can provide. Their mental health and well-being is just as important as their physical health and well-being. So how do we accomplish this safely? I think it is by following the recommendations that experts from both the CDC and AAP and WHO have set forth. The very same protocols we did last year. Universal masking, vaccination for those who are eligible, frequent hand washing, and social distancing. These are choices that benefit each of us and our families, and most importantly, they benefit the communities that we love, especially those most vulnerable people within our communities. We have done this already. I know that we are tired, but we have done this already, and we can do this again. We must do this for each other, and we must do this for the safety and well-being of our children. And like so many other physicians across our county, I firmly believe that the Williamson County School Board should implement these policies to best serve our children. Thank you. Dr. Bunsell, I think you're still muted.
Thank you. Thank you, Dr. Neely, for sharing your thoughts and your experiences, both of which are extremely valuable. Next, we will hear from Dr. Stephen Patrick, a board-certified pediatrician and a neonatologist practicing in Nashville. And Dr. Patrick is also the parent of 2 children in Williamson County schools. Dr. Patrick.
Thanks for that introduction. This weekend, I received a notice from my child's school, who was too young to be vaccinated, that she may have been exposed to COVID-19 on just the first half day back in Williamson County schools. I do appreciate the school's diligence in contacting me, but the truth is a mask a universal masking would make it less likely that she would acquire the virus. This lowers the risk for her and everyone else in the room. Our shared goal is to keep children in schools. We know that's best for them. Williamson County did a great job of this last year by ensuring we had a good school year, and they did this by using masking as a tool. Now the virus is surging, as you just heard, and the question is, why aren't we doing what worked well last year? We should keep doing that. We've also heard that our state had substantial learning loss last year, and we need to follow the evidence and ensure that we lead with science. The American Academy of Pediatrics is clear, and we should have a layered approach. First, everyone who is eligible to be vaccinated should be vaccinated. We know when we have higher vaccine uptake, it means lower rates of community spread, and that protects everyone, including those who can't get vaccinated. And next, we should be wearing masks. The evidence is clear, and we did it last year. It's not too much to ask to protect our kids against this highly transmissible virus. Look, these are challenging times. We're all friends and neighbors. We go to restaurants together, we eat church together, we go to church together. Let's remember to approach each other with kindness. This is about loving our neighbors. This is about caring for our kids. We can do this, getting through this together. We are all in this together. We need universal masking in schools. It protects our students and teachers. It'll help our kids stay in school, and it worked last year. So why wouldn't we do it again this year? Thank you.
Thank you, Dr. Patrick. I completely agree with you that it is a very simple thing to do. And thank you for reiterating that message. I'd like to share some remarks from Dr. Jennifer Kerr, a board-certified pediatrician specializing in pediatric allergy and immunology. And she is also the parent of 3 Williamson County school students. Dr. Kerr could not be here today, and I will be reading her statement. I am a physician, and I am also a parent to 3 children in the Williamson County schools. I am here today because I fear the choice to send my children to school is putting their health at risk. I never imagined school leadership would disregard the advice of experts in my own field and allow my children to be vulnerable to a dangerous virus. 2 of my children are not old enough to be vaccinated. And we have just entered into what could be the worst phase of our pandemic. Please hear me on this. The Delta variant of SARS-CoV-2 has changed the game. It might as well be called COVID 2021. The transmissibility of this virus is tremendous. This is different than last year. Children are transmitting this virus, and the spread within a classroom will be tremendous without universal masking and precautionary measures. Recommending masks is clearly different than requiring masks. I dropped our middle schooler off on Friday, and the masking rate among students could be estimated at only 5%. I stood at our elementary school and watched teachers without masks working closely with elementary students, all of whom are too young to be vaccinated. There is clear data from an outbreak of the Delta variant in the Northeast that even a vaccinated teacher can spread the Delta variant to their students. And unfortunately, there are teachers who are not vaccinated, putting the students in those classrooms at tremendous risk for exposure to this Delta variant. I understand that educators feel the mask gets in the way of their ability to teach. I can see that. The mask is a hindrance, but that hindrance could save a child's life. That hindrance could prevent that child from the post-COVID sequela that they are at risk to develop just like adults. The health of our children must be considered here. The Williamson County schools have approximately 40,000 students. In a school this size, there will be children that die of COVID-19 this school year. And the number of children that die of this terrible disease will be significantly less if you put precautions in place. We are talking about preventing the death of a child. It is unconscionable to not prevent the death of a child. Please do not roll the dice with the life and health of our children. The spread of COVID is very, very high in our community. We are on the uptick of an exponential curve in the number of cases. We know that hospitalizations and deaths will lag this increase in cases. As of July 25th, pediatric cases comprise 20% of the COVID cases in our state. As of August 6th, there were 5,573 new cases among 5 to 18-year-old children in the prior 2 weeks. We do not yet know how our children will handle the Delta variant. We do know that if all 40,000 students caught COVID this school year, it would be estimated that 24 of them would die. And this estimation is based on the original strain of the SARS-CoV-2. Sadly, this Delta variant is not only more infectious, but more deadly. It feels like we are experimenting with our children. This risk is just too high for a child. It's a mask, folks. It's not harmful to you, and it's not a political issue. This is a community health issue that is now about to challenge the health of our children in ways that we have not seen yet. This is a love your neighbor issue. The mask you wear does a better job of protecting others than it does for you. Wearing that mask shows that you care about others and that you don't want to take a chance and infect them with this terrible virus. Teachers wearing a mask shows that they care for their students. Students wearing a mask shows that they care for their teachers. Let's care about each other and our community, stop fighting, find humility, and finally realize we are in this together. Again, Dr. Kerr, thank you very much for sharing your statement. It was a pleasure to share it in your absence. We hope that you can join us the next time. Next, we will hear from Dr. Jennifer King, a pediatric intensive care specialist practicing in Nashville, and also is a parent of 2 children in Williamson County schools. Dr. King.
Thank you, Dr. Bunsell. As mentioned, I have 2 school-age children who are enrolled in Williamson County schools. Many of us have chosen to live here for the great educational experiences and strong sense of community that our children are afforded here. As a parent and a healthcare worker who practices in the ICU, the past 18 months have been challenging to say the least. One of my worries as a mother was the possibility of bringing this virus home to my children when I had witnessed firsthand the damage that it could cause to their lungs, heart, brain, and other organs. A source of solace for me during this time was knowing that my children were still able to attend school in person with precautions in place to ensure their health as well as the health of other children, educators, and school staff. As the last school year came to a close and a growing proportion of the population became immunized, I was hopeful that this school year would be different. Unfortunately, as viruses do, this one mutated and began infecting the unimmunized at high rates. We now also know that the virus can be transmitted by immunized individuals, making indoor masking for both immunized and unimmunized persons critical to stopping the spread of the virus. As a pediatric ICU doctor, I've also noted with the Delta variant that we are seeing younger and younger children presenting with respiratory failure and ARDS as a result of the virus. And our COVID unit, which not long ago sat empty, now has children once again occupying its beds. The good news, we've lived through surges before. We know the things that we need to do to protect our children and to protect our community. In order to ensure that our children can continue to benefit from in-person education, it's imperative that the school board follow the recommendations of the American Academy of Pediatrics and the Centers for Disease Control by adopting universal masking, vaccination where appropriate, good hand hygiene, and social distancing. Our children's lives depend on this.
Thank you, Dr. King. And I want to thank you personally for being on the front lines. We heard from mostly adult intensive care physicians last year, and it's unfortunate that we're in the position now where it very well could be your turn and your pediatric ICU colleagues' turn this year. Wish it wasn't that way, but it looks like that may be where we're headed. So thank you for all that you do, and we pray for your health and your safety and that of your children as well, so that you can continue taking care of the sickest children that end up in your ICU. So thank you for what you do, and thank you for sharing your thoughts today. Last but not least, we will hear from Dr. Diana Saperi-Harvey, who is a family practice physician in Williamson County, also taking care of children. Dr. Saperi-Harvey also holds a master's in public health and is the parent of 2 elementary students in Metro Nashville Public Schools. Dr. Saperi-Harvey.
Thank you, Dr. Bonsall, for the introduction. As you've already heard from all of my colleagues, and as a parent of 2 children who are school age and not eligible for vaccines, we're here to clearly advocate for the much needed vaccine requirement in schools. As a parent of children who attended Metropolitan Nashville Public Schools, I am encouraged that their school board followed the science and made the decision last week to implement indoor masking guidelines as recommended by the CDC and the American Academy of Pediatrics. As a physician practicing in Williamson County, I am here today to call on the school board and Mayor Anderson to follow the example of the MNPS school board and protect children like those of Dr. Kerr's and Dr. Neely's and the approximately 40,000 students enrolled throughout the county. As recently as 2 weeks ago, Governor Lee repeated his belief that kids do not get seriously ill from COVID. However, what we know from science, and you have heard it over and over again today, children do get ill from COVID. Some of them get very seriously ill, and many have long-term lingering symptoms related to long COVID. And as I have already seen in my clinic, this syndrome will negatively impact their ability to learn in school and thrive in their future careers. And we know that children under age of 12, including my children and yours, are not eligible for COVID-19 vaccine and are therefore particularly vulnerable to this dangerous and highly contagious Delta variant. As a physician and a concerned parent, I want the Williamson County School Board and Mayor Anderson to hear me when I say this. Children do get ill from COVID, and we must do everything we can to protect them. In one day last week, I had at least 5 families let me know how scared they were when they dropped off their kids at school and no one was in their masks. These families understand that eventually their kids will also drop wearing their masks due to peer pressure. One of the most precious lessons we have learned through this pandemic is just how interconnected we are, and that our choices impact the health of everyone around us. As a school community, let's choose to do what's needed to protect all of our children. This is not like last year when school opened. We now know from data that in-person school can be safe when mask requirements are applied and enforced, coupled with other risk reduction strategies such as distancing and hand hygiene. Everyone wants their children to have a safe and healthy learning environment, and they expect you, their elected officials and school board, funded by our tax dollars, to provide that environment. If the Williamson County School Board chooses to not follow AAP and CDC guidelines this fall, I fear that at best, we will see schools close and open, as this highly contagious virus spreads. And at worst, we will experience even more avoidable hospitalizations and deaths than we did last year. And this time, it will be in our younger population. As my colleagues who are on the front lines inside in the hospitals have alluded to, and as Dr. Lisa Piercy, Tennessee's Public Health Commissioner, mentioned in a press briefing last week, it is projected that the state's children's hospitals will be completely full by the end of this week. And she's strongly encouraging everyone to get vaccinated to protect our entire community. While in the schools, we know that unfortunately, many of our children are not eligible to receive vaccination. Mayor Anderson, Williamson County School Board members, we implore you to adopt the temporary mask requirement recommended by the CDC and American Academy of Pediatrics that are necessary to keep our children safe in schools this fall. Thank you.
Thank you, Dr. Sapiri Harvey. And thank you for taking care of the children of Williamson County as well. To summarize, we have heard today that COVID is spreading rapidly throughout Tennessee, particularly among our younger population. School closures are already happening, and children are being hospitalized and some are dying. We ask that you hear our voices as the pediatricians taking care of these children in Williamson County, in Davidson County, in our clinics, our hospital floors, and even in our ICUs. As you can see, we are scared of what the next few months will unfold. I join my colleagues in asking Mayor Anderson, school board members, please hear what we are saying, and please don't allow our children to be endangered like this without requiring masks in schools. It's a very simple thing to do. Please adopt the temporary mask requirements as recommended by the CDC and the AAP, which is required to keep children safe in school. That concludes our prepared remarks, and we do have some time for a few questions. So if you have a question, please do raise your hand using the raise hand feature or submit your question in the QA box. So seeing no further questions, thank you for joining our conference today. We will be sending
Dr. Bonsall, we have a question from Jackie Del Pilar.
Hi, sorry, I didn't know if I was unmuted or not. I've talked to a couple Williamson County parents who are advocating for parent choice in this decision about masks. What's your response to parents who say, I want to choose whether my child wears a mask at school, not a school board member or superintendent?
So our recommendation follows the CDC and the AAP recommendations. We understand that parents would like to have a choice, but we are asking for the school board to consider science and data and facts and measurements that we have seen from Tennessee Department of Health's own research. We have other mandates and requirements in place in our society already to keep children safe. Some of that includes car seats and seat belts. And we as pediatricians feel that keeping our kids safe is no different than a car seat.
I was just going to say too that, look, I think part of it is it's about keeping everyone safe, and it doesn't work if we just have a couple of folks wear a mask. And I honestly believe if we just engage in dialogue about this, most parents would have that conversation and understand. I think part of it is just that we aren't talking collectively through the lens of kindness and like we ordinarily do. Let me give you an example. We don't pack peanut butter sandwiches for my kids at school. And we don't do that, not because my kids have a peanut allergy, but because someone may in that classroom. We get letters from our, little notices from school every year. We do that to protect others. My kids love peanut butter, but it's one of those things where, we're helping protect other people. And that's who we are. We are people who take casserole dishes to people's houses when they've had a loss. We look out for each other. And this is just another case of us looking out for each other by wearing a mask. I think the other piece of this too is that this is likely temporary. We know this is going to get better. This is our path to get out. This is our path to keep kids safe and in school. It's a temporary measure to keep us safe and to keep our kids in school.
Thank you, everyone.
So I don't see any further
I
questions.
think there is,
There is, okay.
Dr. Bonsall, there is another question on the chat if you wanted to read that.
Yes, I'm unable to see it. Did it
Got you.
get
So
typed up? Could you read it for me, please?
we had a question about what will it take to increase vaccination among children?
Would you like to take that, Dr. Harvey?
Happy to, and I would invite my colleagues to do the same. And I would reiterate this, the words of Dr. Patrick, that it takes all of us, and it takes conversations, and it takes continuous discussion and understanding by concerned parent. It is okay and normal to ask questions, to be concerned. This virus is new, this pandemic is new, the vaccine is new, but my recommendation to all my patients and families is to continue having conversations with all of us who you trust in the community. You trust us with your hypertension, you trust us with your allergy medicine, you trust us with your asthma medicine. We use the same reasoning, we do use the same science, we use the same data gathering skills that we have learned in medical school and residency and fellowship training to be able to answer your questions on all these other health concerns. We will do the same. This is our oath, this is our promise. We will do the same. So have those conversations with us. We encourage media to encourage parents and community to contact their doctor, contact their health professional in the community that they trust to have these conversations and get their questions answered. And I will welcome anybody else to have a comment on that.
Thank you, Dr. Sapiri Harvey. I completely agree with you. I think my colleagues will agree with that as well. And, going back to the community and what we're already teaching in schools, we teach children how to take care of their teeth. We teach them to brush their teeth, and it is in the interest of their long-term health. And education begins in our schools, and education takes place at home with parents as well. And we want patients and their parents to talk to us and to have these conversations. And so I would encourage everyone to speak with their healthcare provider and seek knowledge from a trusted source, and feel very comfortable in doing so. And opening up for further questions. Okay, looks like we don't have further questions. So thank you all for joining. Thank you all for your time and participation. Thank you to all of the panelists today and all of those who joined. And we will make the publication published, the recording published rather, very soon. Thank you all for your time today and be safe out there.
Thank you. Have a good evening.
Thank you.